So right now is a really exciting time in shoulder replacement. And just in my brief 10-year career, we've come a long, long ways. Historically, hip and knee replacement have gotten all the attention, and now I feel like we're at a point where shoulder replacement has finally gotten the attention it deserves, and the technology is caught up to where hip and knee replacement is. I was very fortunate to be invited to Lugano, Switzerland to learn more about this technology and test it out, and at a conference for shoulder surgeons and shoulder arthroplasty. We had a hands-on lab where I was able to take the patient's anatomy, take the instruments, put it all together, use it, get a good experience with it, and see how it would be beneficial for my patients. New great technology in shoulder replacement is not just the surgery, it's actually planning. So we get a CT scan, we get the patient's anatomy, we plan it ahead of time, and then we implement that plan real time during surgery. And it's not robotic, it's me, I'm looking at the patient's anatomy. I have smart glasses that show me the augmented reality, and I can see the CT scan and know the plan as I'm doing the surgery. I'm not handing it off to a robot. And so the surgery is better, in my opinion, because you're using that information as you're doing the surgery. So I was very fortunate to be the first surgeon in Central Texas to get to use this technology. And when I came home, we put it to work immediately and have had great success implementing this technology into Central Texas and giving our patients the best chance at having a good outcome with their shoulder replacements. This technology is great, and all the technology that we're using, whether it's shoulder, hip, knee, is all fantastic, but you do have to understand that technology has limitations. And the best thing about this augmented reality is that if there is a glitch, if there is something that goes wrong, if you lose connection, if you're in a robotic surgery, your surgery comes to a complete stop, and you have to start all over and you have to pick up where it left off. I'm using this technology, the augmented reality, to supplement what I'm doing and to help guide me. But if worst case scenario comes and that technology stops working, there's no stop in the workflow of the surgery. We can still continue like we have in the past. We're able to move on without it, without causing a major delay or more disruption, or worst case scenario, a poor outcome for your patient. I think the biggest advantage of this technology compared to others is the glasses that have the hologram. And so when I'm doing an operation, what we've had to do in the past is I've had to look at a screen that's this direction while my hands are working here. And so now with the smart glasses, I have a hologram that's in my field of vision. I never take my eyes off the patients. I can keep my eye on the field of surgery the entire time and use this information to better direct and guide where everything is going to go.